السلام عليكم ورحمة الله ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومترك Review of Barometric Test Question. This is lecture number 18, Maternity and Child Health Nursing, and number 57 in Ghaith Review. Today we are going to discuss 5 questions from question number 302 up to question number 306. معكم محمد عثمان يحيى. نبدأ مباشرة. Question number 302. A 38-week pregnant woman complains that she has been craving to eat non-food substance. What is the term that describes this pregnant mother's condition? The options are number A, Pica disorder during pregnancy, number B, bulimia, number C, anorexia, number D, binge eating. وقف الفيديو هنا واختار الخيار اللي تشوفه صحيح. The correct option is option number A. اللي اخترنا الخيار رقم A نشوف rational. Pica is a term used to describe the craving and consumption of non-food substances such as dirt, clay, and chalk. It is a condition that can occur during pregnancy and require medical attention to address potential health risks for both the mother and the baby. So the correct option is option number A. Question number 303. A pregnant client is making her first postpartum visit. She has a 2-year-old son born at 40 weeks, a 5-year-old daughter born at 38 weeks, and 7-year-old twin daughters born at 35 weeks. She had a spontaneous abortion 3 years ago at 10 weeks. Using the GTPAL format, the nurse should identify that the client is, the options are number A, G4, T3, P2, A1, L4. The option number B, G5, T2, P2, A1, L4. Number C, G5, T2, P1, A1, L4. Number D, G4, T3, P1, A1, L4. وقف الفيديو هنا واختار الخيار بنشوف صحيح. The correct option is option number C. اخترنا الخيار رقم C نشوف rational. The term GTPAL, G means gravida, which is total number of pregnancies, including the current one. This patient has 5 pregnancies. And T means term births and equal number of pregnancies carried to the term or after 37 weeks or more. And this patient has 2 term births. P means preterm births and equal total number of pregnancy delivered preterm or before 37 weeks. And this patient has 1 preterm birth, twins. And A, abortion, which means total number of pregnancies ending in a spontaneous or induced abortion before 20 weeks of gestation, and this patient has 1 spontaneous abortion. And L means living children and equal total number of living children, and this patient have 4 living children. So the nurse should identify that client is G5, T2, P1, A1, L4, which is the option number C, and this is the correct option. Question number 304. A multiparous woman is admitted to the postpartum ward after a vaginal delivery. The assessment shows lochia steady trickle of bright red blood and fundus fair, and blood pressure is 110/70, and heart rate 80 per minute, and respiratory rate is 20 per minute, and temperature is 37.5 centigrade. Which of the following is the most likely diagnosis? The options are: number A, endometritis; number B, uterine atony; number C, valval hematoma; number D, laceration of the genital tract. وقف الفيديو هنا اختار الخيار بشوفه سهل. The correct option is option number D, laceration of genital tract. ليش اخترنا الخيار رقم A؟ نشوف rational. First, eliminate option number A because endometritis typically present with fever and full smelling lochia. And then eliminate option number B, which is uterine atony, also because the uterus is firm, which indicate that the uterus is well contracted, making uterine atony unlikely. And also eliminate option number C. Why? Because a valval hematoma presents as a localized swelling and pain in the valval area. So the correct option is option number D, laceration of the genital tract, because steady trickle or ooze of bright red blood suggests ongoing bleeding from a source other than the uterus, which points to the laceration in the genital tract. Question number 305. A 27-year-old insulin-dependent diabetic mother has delivered normally at 38 gestational week. The nurse has assessing the insulin requirement of mother after delivery. What is the insulin requirement for this patient? The options are: number A, higher than before pregnancy; number B, no change in insulin requirement; number C, lower than when she was pregnant; number D, slightly increased than before delivery. وقف الفيديو هنا اختار الخيار بشوف سهل. The correct option is option number C, lower than when she was pregnant. ليش اخترنا الخيار رقم C؟ نشوف rational. During pregnancy, especially in the late stage, insulin resistance increase due to hormones produced by the placenta. This often necessitates higher dose of insulin to maintain blood glucose control. However, after delivery, the levels of this hormone drop rapidly as the placenta is no longer present, which lead to a decrease in insulin resistance. So the correct option is option number C, lower than when she was pregnant. Question number 306. Mother of 9 children, 3 of them with congenital anomalies and 1 with Down syndrome. She is primary school graduate with low financial status. She is not using any method of family planning. Accordingly, the primary healthcare nurse has referred her for counseling. Which of the following is a barrier facing the team responsible for providing health services to the handicapped individual? The options are: number A, sensory limitation; number B, rigid rules; number C, C. Developmental disabilities. Number D. Deafness and hearing limitation. بقعد بدي نختار الخيار بشوفه صحيح. The correct option is option number B. rigid rule. اللي اخترنا الخيار رقم B نشوف rational. Rigid rule means or refer to inflexible policies or procedures and regulations that can prevent effective care delivery. Rigid rules are a systematic barrier that can impede the healthcare team's ability to provide flexible and responsive and effective care to individuals with disabilities. So the correct option is option number B. Regarding to the option number A and D are not barrier. Why? Because sensory limitation and deafness and hearing limitations, they are challenges faced by individuals with disabilities, which require the team to adapt their communication method to solve these problems, and it is not or are not a barrier for healthcare team to provide care. And regarding to the option number C, developmental disability. Developmental disabilities require specialized care, but they are not a barrier that the healthcare team face in providing care. So the correct option is option number B, rigid rule. شكرا جزيلا، نتقابل في محاضرة جاية. Don't forget to support us by comment, like